So you have now been diagnosed with prediabetes. What should you do? People can be diagnosed with prediabetes basically at a stage where their blood sugars are slightly elevated, not high enough to meet the criteria or to be diagnosed as diabetics, but certainly higher than normal. We know that people with a diagnosis of prediabetes have a much higher risk of becoming a diabetic down the road. Fortunately, there are many interventions that can help prevent that progression. Study after study has shown that if you have prediabetes, the most helpful interventions to prevent progression to overdiabetes is basically lifestyle modification, diet, and weight loss. If you lose as little as 7% of your body weight, studies have shown that you can prevent or delay the development of diabetes by 50 to 70%, depending on the study. In terms of your diet, we often eat large portions, high in calories, high in fat. So basically, number one is portion control. So reducing the amount of food on your plate is important, but also the types of food make a difference. Trying to reduce the calorie in the foods. A Mediterranean diet is a very good example where you're reducing the amount of carbohydrates, you're eating more grains and fibers and fruit, and that is a very healthy diet and one diet that can help people with prediabetes avoid progression to diabetes. But the most important thing is, number one, portion control. Eating more whole grain foods versus avoiding refined sugars and simple carbohydrates. And, basically what we should all be doing, eating a healthy diet with a lot of fruits and vegetables, less meat, less red meat. Those are some of the things that I think would be very helpful in terms of managing your diet and helping you lose weight.